Let's discuss epidemiology and management of snake bite. Snake bite is a common problem in India and Pakistan. People are residing in rural areas. Their profession is farming, so they get snake bite. They are exposed to snakes, especially in summer season. We will discuss this session according to following learning objectives. We will discuss epidemiology of snake bite. What are various clinical features? How we will diagnose and management that is very important. In the end, we will summarize the session. Snake. What is snake bite? Venom. Venom is injected by a snake after a bite and it caused life-threatening medical emergency in both India and Pakistan. After injection of venom, people may get symptoms, they may get severe symptoms and they may get life-threatening condition. It's a medical emergency. It should be dealt immediately. What is etiology? There are more than 216 species of snakes but only 52 are poisonous. Remember, there are non-poisonous snakes. Majority of snakes are non-poisonous. So we need to reassure after snake bite. People may die due to fever, due to fear. So we need to exclude fear factor also. We need to educate them that majority are non-poisonous. Major families are cobra. There is common cobra, king cobra, common crate. These are common. This is king cobra. There are vipers, Russell viper, pit viper. They are common. They are hemotoxic snakes. They are common in Pakistan. These are the vipers. They may bite. What is Colubridae? These are largest family, snake family, but majority are non-poisonous. Few produce significant bites and are poisonous. So main poisonous snakes are vipers and cobra. Vipers are hemotoxic. Cobra are neurotoxic. These are the snakes. What are snake venoms? They contain proteins, enzymes, polypeptide toxins. These are the major constituents of snake venom. What are various symptoms? Initially, there is anxiety. When someone is bitten by a snake, he gets anxiety and there is vagal shock. He may die due to this shock. And there are local symptoms. There are fang marks. There is pain. There is bleeding. There is bruising. There is lymph node enlargement. Lymphangios. Lymphangios. There is inflammation. Blistering. There is local infection also. Necrosis is also present. These are the local symptoms. As you can see, fang marks. After the bite of viper, we can see these fang marks. We can identify snake bite from these marks. There is local bleeding at the site of snake bite. There are generalized and systemic symptoms. Generalized symptoms include nausea. Person may have vomiting, malaise, abdominal pain, weakness. He may become drowsy. And there are systemic symptoms also. There is visual disturbance, dizziness. Person may become faint. He may collapse. He gets shock. There is hypotension. Cardiac arrhythmias are common. Pulmonary edema is common. And other disorder, bleeding from recent wounds. There is bleeding from wounds. There is systemic bleeding, neurological signs after the bite of viper. There is drowsiness, paresthesia. There is abnormality in taste and smell. Keratosis, muscle paralysis is common. Aphonia is common. There is difficulty in swallowing. Respiratory generalized flaccid paralysis. This is the most severe symptom. Respiratory paralysis. Skeletal muscle breakdown after sea snakes and Russell viper. There is generalized pain. There is stiffness and tenderness of muscles. There is hyperkalemia. There is acute renal failure. So it causes a lot of symptoms. After bite from vipridae, there are renal symptoms, loin pain. There is hematuria, hemoglobinuria, mycoalbuminemia, oliguria. There are symptoms of urinemia. It can cause renal failure. There are various endocrine symptoms also like acute shock, hypoglycemia is common. Chronic phase, it may last for years. Loss of sexual hair, there is amenorrhea, there is testicular atrophy, and hypothyroidism. These are common endocrine symptoms like shock, loss of hair, amenorrhea, testicular atrophy, hypothyroidism. This is the bleeding. You can remember this bleeding from gingiva. There are long-term complications after snake bite. Patient may become chronic. There are infections, osteomyelitis, arthritis, malignant transformation in skin ulcers. There is chronic renal failure. So after snake bite, person should be monitored. There is diabetes insipidus. There is chronic neurological deficit in patients after snake bite. So long-term complication also occur and there should be monitoring. Person should have a follow-up. There should be regular checkups after snake bites. We need monitoring. What investigation are required? You just remember clotting time and bleeding time. If they are increased, then we need to give anti-snake venom. You can get the sample from here. Other tests, there is decreased platelet count. Platelet count is decreased. White blood count, there is leukocytosis, which may indicate infection. And if you see the blood film, there are fragmented red cells, which are called helmet cells. What is protocol of snake bite treatment? First, we need to reassurance. Then we need to diagnose whether it is a snake bite or not. After diagnosis, management is required. Reassurance is the first factor. As I already discussed, people may die due to fear. We need proper diagnosis of snake bite. We need to see the site of snake bite and management. History is also mandatory. On arrival, first we need to deal with any life-threatening condition like symptoms. We have to provide ABC, airway, breathing, and circulation. If there is evidence of bite, tetanus toxoid can also be given. Antibiotics are not necessary, but they can be considered if there is cellulitis or necrosis, they may be given. So we have to maintain ABC. We have to see the site of snake bite. We can give tetanus toxoid. Then we can give antibiotics. What is diagnosis phase? What are general principles? We need identify snake which is responsible. Because protocol may be different in viper management and in cobra management. We need to keep the person under observation at least for 24 hours. But it is commonly seen that person is discharged immediately. No, we need to monitor. We need to monitor the patient for at least 1 day. And we need to determine if any traditional medicine has been used. What was the exact time of bite? What was the site of bite? We may ask questions from victims. What he was doing at the time of bite, whether he was wearing footwear or not. So we need to take the history from attendant, from the patient. If the patient is conscious, we need to ask questions from the patient. If he is unconscious, we can take history from attendants who brought him to the hospital. Then we need to give anti-venom treatment. Anti-snake venom is given. And remember one thing, child must be given the same dose as the adults. And there is no need for test dose. Dose should be given. And it is given according to severity. If it is mild, moderate, or severe. If it is mild, 5 vials should be given. In case of moderate, 10 vials of ASP should be given. In case of severe infection, severe disease, 15 vials should be given. Like in case of paralysis or progressive paralysis, 15 vials should be given. In case of bleeding from nose and gums, 10 vials can be given. Minimal infection or minimum disease, only 5 vials can be given. You need to repeat this test. And if bleeding persists, you can give blood transfusion also. Remember, ASP should be diluted in 100 ml of saline or glucose. It is administered over 1 hour. So we need to give diluted ASP to prevent arrhythmia. And duration is 1 hour. In duration of 1 hour, ASP should be administered. Also remember, no intramuscular injection should be given in case of snake bite. No IM injection, because it can cause capillary bleeding. So you have to prevent bleeding. What are general symptoms? Patient may feel better. He may have nausea, vomiting, headache. There may be spontaneous systemic bleeding. So we need to repeat CTBT. If there is rise, blood transfusion can be given. Remember, patients who are in shock, blood pressure should be increased within first 30 to 60 minutes. Then arrhythmias will resolve. cause a patient may present with hypotension, he may present with feeble pulse, he may present with no zero pulse, zero blood pressure, neurotoxic, postsynaptic type, and the symptoms begin to improve after 30 minutes, or it may take several hours. If there is may active hemolysis may occur within few hours. There is decoloration of urine. So after ASV administration, all these symptoms may resolve. Criteria for giving antivenom. Antivenom can be repeated if persistence of bleeding symptoms persist. We can repeat antivenom. After repeating antivenom, we can consider blood transfusion. So we have discussed epidemiology of snake bite. There are three types of main snakes: vipers, cobras. These two types. There are two types of poisonous snakes: vipers and cobras. They are common. Their bites are common. We have discussed vipers are hemotoxic, cobras are neurotoxic. Then we discussed snake bite is more common in rural areas, more common in rural population, more common in farmers, more common in those who walk barefooted, more common in those who walk at night time without torch. Torch is advised at night time. Footwear is advised at night time. There are various symptoms like itching, bruising, bleeding, cellulitis, lymphadenopathy. Then how we will manage the case of snake bite? Main aim is to reassure the patient. Person may die from vasovagal shock. So if you receive a patient of snake bite, first you should reassure the patient. Then you diagnose whether it was snake bite or not. You have to perform certain laboratory tests like clotting time and bleeding time. If they are raised, you need to give anti-snake venom. Plus, you have to treat the shock. You have to treat the hypotension in case of severe illness. You should take the history from attendants, from patient if he is conscious. So you reassure, you perform laboratory investigations, you inject anti-snake venom. Dose is same in children and adults. There is no need to give test dose. You should dilute the dose in 100 ml normal saline, then inject it in the period of 1 hour. In case of mild illness, 5 vials should be given. In case of moderate illness, 10 vials should be given. In case of severe illness, 15 vials should be given. Then you can repeat the test and repeat the dose. You can do blood transfusion. Plus, you can do other preventive measures like footwear, torch. You need to educate your community that majority of snakes are non-poisonous. You need to reassure footwears, torch, they are essential. People working in farms or farmers, they should be educated regarding snake bite. It is common problem and vaccination should be provided at the primary healthcare level. So you must remember, anti-snake venom vaccine should be provided at primary healthcare level, like in BHUs and RHCs, those who are vulnerable. So, principle of primary health adopted is equity according to needs. Snake bite vaccine is more required in rural areas. Is more BHUs and RHCs are situated at rural areas, so it should be given in rural areas. So, principle of equity is adopted. At primary level, snake bite vaccine is provided. It should be provided. Healthcare workers should be trained. Remember, it should be diluted. It should be injected after at the duration of 1 hour. It can be repeated. So you must train the workers. You must educate those who are vulnerable. So health education also plays an important role in prevention of snake bite. Snake bites are common in summer season. They are not present in winters. So during summer season, anti-snake venom is required. It should be provided. That's all.